Blog Talk Radio.
All right, greetings everybody. As always, we'd like to give you a warm welcome to today's show. I'm your host, of course, Faith, and you're hanging out with us live on Her Story 2. Welcome everybody. I see you all trickling in. Keep on coming in. Hi everybody. Hi. I see you all. Welcome to all our guests. Yes, we do have another special guest. I know y'all are spoiled for choice this week, right? I know, you enjoyed it? Yeah, that was Susan. Yeah, hook up with her on Twitter. Yeah, but today we have a special guest, and our special guest is Fatou Baldeh. Yes, Fatou Baldeh. She's one of Scotland's most well-known and knowledgeable FGM activists. So you all already know what FGM is, right? Because we got the insight from Ali Matu, right, who was on the show. Yeah, but for those of you who are new to the show, FGM is also known as Female Genital Mutilation. Sometimes it's also, referred to as, female circumcision. But we have the expert joining us today, and she's going to talk a little bit about that. I have to go ahead and give you all those directions to find your way around beautiful Blog Talk. As always, we're looking forward to taking your calls as well. We'd love to hear from you as well. You'll know how we do. So let me go ahead and give you the call-in number, which is 515-602-9735. That is the number to call. Remember, y'all, if you're calling from outside the U.S., remember to dial the U.S. country code, and that will get you right in. All right, everybody, greetings, welcome. Y'all on the call lines, you know how to do. You need to push 1 on your keypad. That's my cue. You want to jump in. But before we dive right in, I have to give a big shout out. You know how we do. We have to thank all our listeners from across this beautiful world of ours. And we'll start right in the U.S., up there, and say hello and a big thank you for all your support. Big up to all our American listeners, our Canadian listeners, our listeners in Nigeria, Greece, in Italy, in France, in the UK. UK be showing us mud love, y'all. I have to say that, okay, now. Of course, we also have to give a big shout out to all our Norwegian listeners here in Scandinavia, right here at home in Denmark and Sweden. Thank you so much. We're going to go back to the continent, Africa, and give a big shout out to our listeners in Uganda, in Kenya. Big up to Kenya, by Ghana, y'all. And Mali and Cote d'Ivoire, as well as Ivory Coast. How dare I forget Ivory Coast? Ivory Coast, Black Show was mud love. And Ghana. How dare I forget Ghana? Okay, y'all. We got to move on because I know y'all be really wanting to bite my head off if I forget y'all, okay? So we're going to come back to Europe, okay, and give a big shout out to Switzerland, Belgium, Russia, India. We're going to go a bit up now to India, to Asia, and give a big shout out to Indonesia, who shows us absolutely mud love. The Philippines. I said India, y'all. Yeah. I think I've covered y'all. I left out Spain and Germany. Yeah. Okay, y'all. I think I have covered everybody. No, the Philippines. Thank you. Okay, y'all. Mexico, of course. Thank you. Anyway, so let's go ahead and bring in our special guest. Yeah, we have Fatou here with us on the line. Fatou, say hello.
Hello, everyone. Hello, Faith. Thank you so much for inviting me to your station today. I am very delighted to join this conversation.
It's an absolute pleasure and an honor, y'all. I didn't finish telling you all about Fatou because she's also been involved in campaigning against FGM in Scotland for over 5 years. And she's done research into the NHS Scotland obstetric care for women who have experienced FGM. And Fatou has also worked on FGM in the Gambia and is a change maker within her own family and community. I absolutely love that. I think everything starts with family, really. I'm a true believer that, we can say all these pretty things out there, but you have to start at home.
Absolutely.
Yeah. So, Fatou, where do we start? This is one of those topics that, everyone wants to run away when they hear it. It's like they want to run away, but some want to know more about it. Others don't even know it happens. They don't know it exists. So what do you say we just start with maybe what is it?
Yeah. What I say is that FGM is everybody's business. Violence against women is every business. We all need to address the issue. For a very long time, a lot of people just shied away from female genital mutilation. But it is about time that we all stand up and put our foot down. We all contribute towards seeing an end to this harmful practice that is affecting millions of girls and women across the world. Yeah.
Yeah.
That would be a starting point for me, really, yes.
I think it's very important, and fine, but we're not doing all that we possibly can do because we're in the 21st century, and really there's certain things that I think should become history. Like it should be something really past tense. And you make such an important point because we had a show earlier, actually on Sunday, and the question was posed in the chat, is it only happening in Africa? And the thing is, this is, again, I think, the assumption that a lot of these problems are developing country problems. Child marriage, all these things, human trafficking. It's a global problem. Yeah. And I think... Mm-hmm. Yeah, and you know what, Fatou? So we've had a little bit of a discussion in the past on a couple of shows, and we're talking about when you work in this field. So we hear words such as barbaric, horrific, and we were actually saying that's a huge disrespect to these cultures. But you're working in this field. How do you think? What do you think is the best approach to make people say that you respect their culture, you respect their traditions, but there are better ways of doing, for example, rites of passage, or doing other, or addressing this issue? Mm-hmm.
I come from background. I'm originally from Gambia, and FGM is widely practiced with my family. Every female member of my family is present until like just my nieces just now, before that everyone else has undergone FGM. So my mother was a partner who was heavily involved in the whole ceremonial thing. So growing up, for me, FGM was the norm. It was what was normal. I never questioned FGM. So before I got involved in this, if you had asked me about FGM, I would tell you that it was my culture, it was my religion, because that's what I was told, and that's what I understood it was as, and I didn't anything wrong with it. And when I was in university, one day we were doing a course on gender-based violence, and the issue of FGM came up, and I was in class telling them how, it's not wrong, this is something that we do, and I'm trying to justify to everyone why we did it, And after that, I decided to do my dissertation on FGM because I wanted to find out more. And I remember when I was writing my dissertation as well, every time I was reading every time I read the term, I kept saying to myself, I'm not mutilated. That didn't happen to me. I was compared. And I got very upset about it. I was questioning everything, but that dissertation changed my life, and that dissertation changed a lot of girls in my family, their lives. Because of that, I realized that actually this is a tradition that is wrong, that harms women. But prior to that, I didn't have that knowledge, because I am sure since you've had other people, for instance, Halima, speak about FGM, she probably mentioned this as well. When we undergo FGM, we are not told about the implications that FGM has on women. And if you are from a community where every woman has undergone FGM, when women feel complications, when they're experiencing problems around their sexuality, around their health, psychological, physical, mental health, we do not usually associate this with FGM itself. You tend to believe that this is a problem that every woman has, because everyone around you is experiencing the same thing. So you do not question it and you do not link it. So for me, what changed my perception about FGM was seeing that link between FGM and health, how it done by the human rights approach towards FGM, that you're doing something harmful, it's against the human rights of girls and women. A lot of Africans don't buy that, because when you do that, they will sit down and start justifying or giving you examples of other things that happen here, for instance, in the West, in the developed world, in the West, that they see as harmful or something unhealthy that people are practicing. They will start comparing that. But what I find that has worked is when you put the link, the help, when you start explaining to women the reason you're having very bad periods is because of FGM. The reason why you're not enjoying sex is because you've experienced. And you put that link and you try to get people to understand that. And another thing that I find is like when men see their wives giving birth and they see how this has affected their women, then they start thinking, actually, I don't want this happening to my daughter. I have seen that working more effective than using the human rights approach from my perspective.
Yeah, and I'm from Kenya myself, and FGM is also practiced within certain cultures. Again, I think also we should be also like clear, because when people say it takes place in Nigeria, it's not the whole country. There are always different parts of these countries where it takes place. Not every culture, tribe practices this. But in Kenya, I think I agree with you, because the human rights approach doesn't work. In fact, it is your first way to be kicked out of that community very fast. It's a quick exit. But if you use, like you're saying, the health implications, like the physical health, severe pain, hemorrhaging, infections, urinary retention, fistula, whatever, all these other things, then they know this is serious, because those are things that they're dealing with every single day, and it's causing them shame and sometimes death. So I think I agree with you that I have seen this approach more, it's received much better.
Yes.
Yeah, and especially in the long term.
Yeah, I also think that like bringing it, what I get from, for instance, my community and some members of my family is, you're being brainwashed, you're being westernized. That's why you say this is wrong and all that. That is, if I try to use the human rights approach, that is what I get a lot. But whereas if I bring this health perspective and try to explain, so for instance, my mother, she didn't go to school, so when she knows what I do, I have explained to her, and she initially used to just laugh it off and say, I don't know what you are doing. Why are you saying that this is wrong? She couldn't understand. It took me years to try to get her to understand, and it's been difficult, especially within my family, because I have a lot of other female young girls in my family who were at risk of FGM, and until just last year, the issue of them having to undergo FGM always comes up. It's that time of the year the girls need to be cut, and I would need to intervene and say that you cannot do this, and But for me, bringing that change in my family, knowing that, because all it takes is to break the cycle in one generation. That's all it takes. If you break it in a family in one generation, the next generation is safe, and the one after, and the one after. So I know how difficult it is to break that chain, the first chain, because this is something that I had to undergo for quite a long time.
Yeah, and I think sometimes people just say these words like, just stop it. It's easy, it's a terrible thing. It can just end. But I think what you're saying is just so important. You're talking about people's culture. It's like telling someone, I don't want you to celebrate Christmas. I know I'm not comparing the two, but these are things that they hold dear to them.
That's it. It's a deeply rooted tradition that has been practiced for centuries. It's embedded in everything people do. So, for instance, in the Gambia, FGM is not just about the cutting itself. So when girls are cut, you are, like you said, it's a rite of passage. During that time, girls are taught how to be, quoting this, women when they grow up. You're taught how you're supposed to speak to your elders, how you're supposed to do a lot of things in the community as a woman, how you are expected to behave. And these practices, these are all instilled in you during this period. So that's why we say FGM is not just about cutting, and that's why it's also difficult for families, for people that have practiced it for many years, to just say that we are going to stop this practice. And also it's the stigma that you receive. People get stigmatized if they come from a community that practices FGM and they've not done it. They would be the ones that are bullied. They would be outcast, and it is very difficult for those people. Again, this is why it's difficult for those communities to stop the practice.
Yeah. And Fatou, just tell us, I know the list is long when it comes to physical health or sexual health, but just tell us some of the main ones or the obvious ones that somebody who is going through these things and may not even know what caused this, or even think that that's a problem, because a lot of things women go through, they just think, oh, well, every woman is going through that. Like anemia, it's normal. Let me just eat some spinach. But they don't know sometimes it's chronic anemia. So maybe just tell us, a few of the impacts of FGM on physical health as well as on sexual health that we should really look out for.
Yes. So first of all, FGM, when it happens, it has both immediate complications and like short-term and long-term complications. So short-term complications include bleeding. So some people will bleed to death or lose a lot of blood during the process. You can get, because, for instance, in the Gambia, FGM is done traditionally. So it's done by someone who has no medical background. They use the same equipment to cut several girls without sterilizing them. So you can imagine the transmission of disease. If one of those girls have any bloodborne diseases, the remaining that are cut, it will be easy to be transferred to them. So you get those immediate, even then, some children die from it. But also you do get the long-term complications that are associated with FGM as well, which so a lot of women would experience severe pain during their periods, UTIs, urinary tract infections, cysts, and repeated infections, complications during childbirth. It's also been associated with increased risk of newborn deaths as well. So there are loads of complications, but also the complications depends on what type of FGM the woman has had. So, like there are different types, where type 1 is the clitoris that is removed, type 2 involves removing the clitoris and the labia, and type 3 involves stitching. So there are all these different types. So the severity or the complications depend on which type of FGM you have had. Mm-hmm. But I have spoken to a lot of women who would tell you that, for the rest of their life, they have complications because of this, which is very sad. And also, of course, the trauma, which affects a lot of people, their mental health, because of they feel betrayed, also because of having to experience, the trauma of having to undergo this whole painful procedure. A lot of people cannot take it out of their mind, and it does affect them a lot. I met a young lady who was explaining, she was taken back to her country of origin. She was born outside in developed country somewhere, and then she was taken back to undergo FGM, and she said it basically destroyed her relationship with her mom. She could never trust her again, but she also found that she couldn't say no to anybody. She couldn't say no, and she said this has affected her relationship. With a sexual partner, she couldn't just bear anyone touching her because it always reminded her of that incident. I also speak to women who are desperate to go and have a smear test, but are fearful. The thought of someone going down and examining them is just beyond them. So there are numerous of complications that are associated with the practice.
Yeah, the psychological is intense. So these are things. I mean, you've covered actually the psychological, effects as well. So you've touched on the physical, the sexual, the psychological. So clearly there is a problem. And you've also, you work with the obstetric. Yeah. And is this like maternal health or?
Yes, maternal health. Yes.
And tell us a little bit about the impact on the maternal health.
So for a lot of women, for instance, for a woman who's had FGM type 3, that's where you're all stitched completely and you're left with a very tiny hole just to pass your menstruation and urine. So you can imagine that woman being pregnant and expecting to deliver a child, how difficult that would be. So for instance, in the UK, that happens if a woman is sick. There are procedures that they follow, and the woman can go and have good before they have the child, or they can choose to have it during the time of delivery. But it's very traumatic. So when I first did my research in Scotland around FGM, this is back in 2011, I interviewed a lot of few women who had FGM type 3, and they didn't have very good experience having children here because they felt that the doctors back then were not very aware of how to handle women with those type of procedures. However, this has changed significantly in Scotland. We've had some people who have taken this on, went and did courses and come back and tried to help women to have delivery. But also I have met some women who have said to me that it just to highlight how strong the issue of FGM is. So I have met, in the recent research that we just completed, I have met some women who said they had FGM type 3 where they were stitched closed, but when they were giving birth, they were open, they had a baby. But when they go back home on holiday, they're expected to stitch themselves back up again. So it's not now the trend to young people, like young girls. It's actually happening to women. The pressure is on women to go back and have it done. And when you ask these women, why do you do that? Why do you choose to have this done again? Some women would explain that, my husband wants me to tighten myself up, or my husband's family thinks that I should do it, or other women are putting pressure on me, or my husband is putting pressure on me saying that if I don't tighten myself up, which means stitching the whole vagina back up, then they might go and find another wife, which is very sad and heartbreaking, because these women know how difficult it is when they had to go through it the first time. But recently I've met a couple of midwives who have said to me that they've on an occasion where they've seen a woman before who's had a baby, they've removed the stitches, and this woman have come back 3 years later pregnant again, and the stitches are closed again. So that is just to highlight, how deeply rooted this practice is among communities that practice it.
Yeah, but if you take this, if you think women have to go through all these horrific things, and I'm not using the word horrific because the problem is compounded. You have health implications, you have psychological implications, you have maternal implications, you have health. And all these issues that you're mentioning are life-threatening.
Yes.
You can die from loss of blood just like that.
Of course. And I think one other thing that sometimes we tend to forget, so especially for people that I've spoken to here, I think it also has an influence to domestic violence. So you see some women would say during this research that we were doing again, some women would say, I do not enjoy sex, I do not want to have sex, but then my husband wants to have sex, and if I don't want to have sex, that bring other issues within the marriage, and so it does contribute to a lot of issues as well.
Unfortunate. It's really unfortunate, and I keep on thinking as you're talking, I'm just thinking this is the 21st century, and the women still feel an obligation. There has to be a very deeply ingrained psychological trauma or something that has happened for you to feel obligated to want to even go and do the surgery and stitching several times. To please somebody who clearly does not care about your health and your well-being.
Of course. And the practice of FGM, there's loads of, maybe some of the listeners are thinking, why would anyone do this? Because if you meet someone who comes from a community that doesn't practice FGM, they find it very difficult to understand why anyone would do this. And I've had some people come to me and say, do you hate your mother for making you undergo FGM? My response is always like, no, I don't. Because for my mother, when she was performing FGM on me, she thought she was doing what was best for me. In a community where a mother thinks that the future of her daughter lies on having a good husband, for her daughter to have a good future, to have a good life ahead, is to have a good husband. And a good husband means you have to undergo FGM. In most of these communities, you must undergo FGM in order to have a good husband, which is why parents are pressured to perform FGM on their daughters. And I have still, sometimes we get debates on social media and someone will bring up the topic of FGM and you speak and you try to explain and I get attacked by other, like especially men, writing, saying that for instance, you're not religious, you're talking against, for instance, Islam, you shouldn't be saying that this is a religion requirement and you should be practicing it. They think that it's something that should happen.
But is it really? Because even in Kenya, when the discussion is taking place, even about the culture and the rites of passage, there is actually almost very little evidence as to why this culture has to be practiced like this.
Exactly.
It's just something that came from, I don't know, it almost looks like it just appeared and people conformed and now do it. Because in the religion context, at least, from people, outreach workers who I know have worked in this area, they have said there's nothing religious about female genital mutilation.
The practice of FGM predates Islam, it predates Christianity. It's been happening for centuries prior to this. But for me, where I come from, FGM is strongly associated with religion, especially Islam. A lot of people are associated to religion. And for instance, again, in the Gambia, a lot of the older generation are not educated. And Islam, the Quran, and the religion is interpreted to women by men. And usually when it is interpreted, it's interpreted in a way that, suits men. And that's not just Islam. It happens in all these other religions. If it is interpreted, that's what happens. And I think that's one of the problems that has influenced the practice of FGM. Because a lot of women, even myself included, this is what I was always told that it was part of Islam. And I grew up believing that.
Yeah, but is it written anywhere in the Quran or the good book, as my friends call it, the good book? Is it written anywhere? No, I don't think so.
I have seen, no one has quoted something from the Quran to me to show me that it is a requirement. And also, as Muslims, our Prophet, peace be upon him, he had daughters, he had wives, and there's no record anywhere that his daughters or his wife had undergone FGM. So if this practice was something that was required by Islam, I suspect then those women in the Prophet's life would have undergone female genital mutilation. And they have not undergone it from it, that's not recorded. And my because I do get that argument, people put that to me a lot. And one of my strong arguments is that, look, if God makes you, who are you to say that that person has not been made perfect? Why do you have them? If God didn't want me to have a clitoris, he wouldn't have, or God wouldn't have put it there for me. It is there because it should be there. So who are you to say that it should be removed and then you associate that to religion? If we believe in God and we believe in religion, then we believe that God is the best creator. So if you tamper with his creation, then you are questioning his creation.
Yeah, and also in the Christian belief, in the Christian religion, they say that every human being has been beautifully and wonderfully made.
Created, absolutely.
So I think, like you said, there's a lot to do with the interpretation, of these books, and I think it's very unfortunate that it's causing people, it's putting people's lives at risk. There's a question that I'm getting here. Okay, they're saying, what is the link between FGM and ethnicity?
Okay.
I don't know. That's a very interesting. Good question,
Yeah, this is a very good question. So where I come from, in the Gambia, we have different techniques, different tribes, we call it, and I understand this is the same in a lot of other African countries. So not all tribes practice FGM. So in the Gambia, we have a couple of tribes that do not practice FGM. And also the type of FGM that the girl undergoes also depends on the tribe that the girl comes from. So the issue of FGM is very complex. Yeah. So ethnicity has an influence on whether you undergo FGM and what type of FGM you have.
Yeah, and also there's another question. What age is FGM performed? Because they say we keep saying young girls. Did we say young girls? But maybe you've done some research, guest. Oh, you've said it. Yeah, okay. So what is the age?
This varies. In some countries, FGM is performed. In the Gambia, the mean age is about 5. So it used to happen between 5 and 8.
5 years.
I underwent FGM when I was 7. But in recent years, this has shifted. A lot of girls are having it when they're very young because people believe that if they're little, it will be less painful or the girl might not remember what's happening. So in some communities, the FGM is performed as soon as the child is born. In other communities, it's when the girl, before they get married. So it varies from community to community. You can go to the same country again, repeat it, going back to the first question about ethnicity. That also, it depends. Ethnicities have different types or times when they perform FGM on girls. And it also varies from country to country.
Yeah, but now, Fatou, you've put a twist to my understanding because I understood it as a rites of passage, but now 5 years old, 7 years old, it's no longer that's called a rites of passage, is it?
And those are the myths. There is the myth. How do you teach a 5-year-old girl how to behave like a woman?
Yeah, or a little child.
There's a lot of misunderstandings. And one of the big issues is that FGM, even the women, a lot of the women that practice it don't understand it. Because once you undergo FGM, you are told you don't talk about it. If you speak to a lot of other survivors of FGM, one of the things that everyone would tell you, regardless of what country or tribe they come from, one rule is you do not discuss what happened to you. So people don't discuss it, so people don't understand the whole process of it.
Yeah. Really unfortunate. So it's like now you're saying, pain is pain. You're just reducing the age that this is not the way to go. It's definitely not the way to go.
To do with the law, a lot of countries have banned FGM. So parents believe that if I do it at a young age, it is less likely for it to be noticed. It is less likely for authorities to know that it has happened. Whereas before, when you bring in the rite of passage, it's a group of girls that are cut together and they do all the extra things that come with the cutting. Now, a lot of people do it undercover, and they do it when girls are really, really little.
Yeah, and now when we talk about the law, I think, a lot of times there are a lot of things that are illegal. But do they happen? Yes. I mean, you'd be highly naive to believe that just because somebody said it's illegal. We're talking about it right now because clearly it hasn't stopped.
Yes. But I think like a lot of countries have a law. They have a law against FGM, but it's one thing having a law and another implementing the law.
Yeah, because the culture is the people. The people have to understand the law. If they don't understand the law, then they will not apply the law. They won't respect the law, And I think Africa is also quite complex because we have different tribes with different cultures and traditions. So I think, correct me if I'm wrong, but like in Kenya, we have overlapping laws. We have laws and we have customary laws. So even with marriage, you can be married like this, but you're also married, and it's recognized within certain customs and tribes. So we have layers of laws. So, I'm just wondering, are there consequences? When somebody is caught doing this practice, are there consequences?
There should be, as per the law, but then it's prosecuting that person. So again, a lot of people protect each other. This is a practice that communities feel is something that belongs to them. So most times, even when this happens, it's not something that is reported. So a lot of the time, the law is just there on pen and paper, but it doesn't have a big influence over the practice, whether it continues or not. So for me, what I think should happen is raising awareness, making people aware of how the practice affects women's health and also not just women, because when you're in a relationship as well, how it affects your relationship as well, is to highlight those links, is to work with grassroots level, teach young people how FGM affects them, and hopefully we can break that cycle from by educating those young people so that they don't do it to their future daughters. I think that's one of the ways, which is at the moment, which is a big movement in the Gambia. We have a lot of organizations, grassroots organizations that are working really hard. Young people taking on the fight and saying that we don't want this. And I think that's one way to see a change. Because at the end of the day, for a lot of the older generation, they've already undergone FGM and they've already got their girls. So these future generations that are coming, they're the ones we really need to educate to make sure that we break that barrier.
Yeah, absolutely. I totally agree with you because I think it's a mindset thing. It's a family thing. It's a community thing. It's not just putting laws in paper. It's like, I'll just give a quick example because I know we're running out of time. But in Kenya, you have, for example, the inheritance of land. There's a law that women should now inherit land. But if the father does not see you as fit to inherit the land is his land, so he has a legal right to give the land to whichever child he feels can take care of the land. So if he has the bias, he's not done anything wrong. It's a mindset where he has to come to the realization that my children are all equal, both of them are highly capable of taking care of the land, and then he can apply the law. So we have laws, but is it being applied? Because the family, again, the mindset, the culture, the traditions, the beliefs, they affect how people apply laws. And so that's why when I was reading, your profile and you said, the family, I thought that's such a beautiful approach because it's so important within your family and the community.
Of course, that's where you start. And another very important part that we should also add is men. They are very influential partners in ending FGM. I think if men start standing up and saying that we do not want our daughters to undergo FGM, I do not want to marry a woman who's undergone FGM. And if we change the perception of men as well, that would also contribute highly. And also religion leaders as well, so that they can clarify the myths around FGM and religion. That would also have a big impact in ending the practice.
Look at that. You have put it So perfect. That has just demystified a lot of things. And Fatou, we have 1 minute left on the show. I want to thank you. It's an absolute pleasure and an honor having you. I hope you will come back because we have so many other questions, and maybe we should talk more about demystifying it, the approach from the community leaders, and also what the men can do maybe in a future show. But before we head out, just tell us how we can reach you, read more about your work and get involved before we head out.
Oh, thank you very much. I'm so grateful to come on air today and chat about this, the work that I do. I am on Twitter, and my name is Fatou Baldeh. Just tweet me or add me on Facebook. I am always available to talk to you. If you have any questions that are not, we don't have time to answer just now, feel free to send me a message, and I will speak to you.
Okay. So y'all, please go ahead. The more you know, the more you're able to respond. I always think when you have the knowledge, you react differently, y'all. So get in touch, read about it. I'm sure some of you have taken a pearl or two. And we thank Fatou for your time, for your insights, and sharing your knowledge. Everybody else, thank you so much. We have to head out now. And as always, we know you all are going to do what you want to do, but we ask you to do something to change the world. Okay, everybody? So take care and goodbye.
I'll be a better man today. I'll be good.